Okay, this video is going to be a quick one. Should you get a cardiac calcium CAT scan? Most of the time we call a CAT scan a CT. CT means computed tomography. It used to be done all in the transverse plane, and that was called computerized axial tomography. We usually just call it CT. All right, if somebody's really sick, acutely ill, and a doctor says get a CAT scan, yeah, you bet it could potentially save your life. I'm not talking about all CAT scans here. I'm talking about cardiac calcium CAT scans. Okay, the other thing is cardiac calcium CAT scan, CT, is not the same thing as a cardiac CTA. When you put the A after it, that means arteriogram, CT arteriogram, which means injection of contrast into an arm vein, and then the bolus lights up the veins and the arteries within the heart, the coronary arteries, so one can see if there's a narrowing. That's a more precise test. Those patients usually are already known to have a problem before they'll do that. And there can be times when that's a good thing, and we're not going to talk about that today. We're going to talk about a non-contrast CT of the chest through the heart to look at the calcifications of the heart. So first of all, most people who don't have a lot of experience with radiology, they all worry about radiation. Oh my God, what's the radiation? Yeah, you don't want unnecessary radiation without a good reason, but that's not the main problem with getting screening CAT scans, okay? The main problem, anybody who knows body CT, so the way radiology talks about the human body is there's the head with the brain inside, okay? There's the central nervous system with the spinal cord. Then there's the chest and the abdomen and the pelvis. So the chest, abdomen, and pelvis are called the body, all right? So body CT means to read chest, abdomen, and pelvis. A lot of radiologists specialize in that. And the reason I'm using that terminology is, here's a question. This is an old joke. What is the definition of a healthy person? Healthy person is someone who hasn't had a body CT yet. And the joke is that when you do a body CT, almost everyone has some little quirks about their anatomy, some normal variations, some old scar tissue from previous injuries or previous infections. And sometimes you can't tell those from cancer. Like you can have little nodules in your lung from when you had the flu when you were 10 years old, and you'll have a scar the rest of your life there. But the first time it's seen on a CAT scan, you only have one snapshot in time. You can't tell if that's cancer or not. So that person could get stuck coming every 6 months or so for follow-up CAT scans for at least 2 years. If it's a ground glass nodule, maybe for 4 or 5 years. So you can get suckered into a lot of money. Let's say you go for a free scan at some private practice hospital, and you have to pay for the future ones out of pocket. They'll find some ground glass nodule. You might be stuck paying for follow-ups for 5 years. Plus, then you're scared. Oh my God, what if I have cancer? I can't make any life plans. I can't get married. Maybe it'll protect you from that. I can't buy a house because you don't know your commitments to it. And the reality, usually radiologists can look at something pretty fast and know if that's likely to be cancer or not. But they got to be careful. The radiologist can see hundreds and hundreds of those, so they tend to just follow them because they don't know. We'll see. Give it a year or two. Typically a solid nodule, you follow it for 2 years. So the point I'm saying is you don't want to get stuck in these follow-up loops for nothing and be stressed out for nothing. There's tons of things that can show up as maybe it's cancer on a body CT. Atypical kidney cysts, I see those every day. Atypical areas in the liver, see it every day. Possible spine lesions, see that every week. Thyroid nodules, all this stuff. The vast majority of thyroid nodules are benign. But once you get them, you're obligated to work them up. Maybe it's cancer. Okay, so what I'm trying to say is be smart. Look at the people who are the healthiest in the world. There are these plant-eating people in these rural areas that just keep moving all day long, have a nice social system, a sense of purpose in life, a religion, a family community. They're the healthiest people in the world. Imitate them. You're not going to get healthy. I mean, like a dumb person thinks, well, gee, I've got to be responsible for myself. I got to get all these tests. No. If you have it all depends on your pretest probability. If you have a high pretest probability, it can make sense to check for a problem. But if you've got a low pretest probability, you go looking for a problem, you're going to find a bunch of false positives, and there's tons of them, okay? So you don't want to go looking for a problem when you're feeling good, doing good. So the smart move is just take good care of yourself and forget about it. That's the smart move. That's what I do. Believe me, I've studied and thought about this every day for decades. Okay, now there's a movie on the internet you could see. It's called The Widowmaker, and it's entertaining. It's really a commercial for cardiac calcium CT, okay? They pretend, oh, we're so scientific, this great thing. Cardiac calcium CT can have some significant medical benefits. I think basically the stupider the person, the more likely it is to help them. And the reason I say that is, if you've eaten a sad diet when you were younger, as most of us have, you've got coronary artery atherosclerosis. You don't need to check a CT to know that. I guarantee it 100%. You've got coronary artery atherosclerosis. So what are you going to do? Esselstyn's patients, Journal of Family Practice, July 2014, 99.4% no recurrent coronary events. Only one had an event. That's a patient who didn't follow his diet. So just follow the diet and forget about it. If you follow the diet, you have an incredibly low risk of ever having a cerebrovascular event, cardiovascular event. So why not just do that? If you do the CAT scan and you find that there's a lot of calcium in your coronaries, what are you going to do? If you're smart, you'll do the Esselstyn diet. Okay? Well, why not do the Esselstyn diet anyways? Because you already know you have it. So why radiate yourself for nothing? Why get stuck following up a whole bunch of incidentalomas, being worried and stressed for nothing, potentially losing a lot of money on your pocket paying for the follow-ups? Why do it? Possibly having to go for biopsies and all this other stuff. Why not just eat the Esselstyn diet, 100% plant-based, low-fat, and then you won't get coronary artery, and you're done with the problem. You solve it. It becomes a non-issue. That's the smart thing to do. William C. Roberts, the most famous cardiac pathologist in the whole world, he said, if you feed a herbivore a high-fat diet, they all get atherosclerosis, 100% of them. It's the same thing with humans. We're herbivores by our physiology. We all have atherosclerosis if we ate a high-fat diet. So stop eating a high-fat diet. So anyways, there it is. By eating the Esselstyn diet, regardless if you're going to get the scan or not, you just eat it, you can forget about it, and then you're highly protected. Now, if you've already seen a doctor and he's telling you something, I'm going to leave that between you and your doctor, but I'm just telling you what I would do, how I see this situation. You do whatever you want, but I'm just letting you know how to think about these medical problems. The smart move is prevent a medical problem. So, okay, you have to make your own decision. This is not medical advice. This is just educational about understanding a little bit about coronary artery atherosclerosis.